Today we're going to be talking about the pelvis. So this is chapter 8 in your book. So this here is a coronal MRI of the hip, and as you can see here, this is what we call AVN, so avascular necrosis. Review, here we go. We have the sacroiliac joints with the sacrum, the lateral mass or the ala of the ilium, arcuate line. We have your coccyx, ischium, pubic symphysis, inferior pubic ramus, and your superior pubic ramus up top with your acetabulum, ilium, and iliac crest. Looking at a CT 3D, we have L5S1 with your coccyx down below, your sacrum here, sacroiliac joints, ala, iliac fossa, your acetabulum, femoral head, femoral neck, your greater trochanter, your lesser trochanter, your superior pubic ramus, your inferior pubic ramus with your pubic symphysis, ischial tuberosity. Always remember you sit on your ischium. That's how I remember it's the lowest portion. Here's your ischium with your obturator foramen. You have your pectineal line, and your up top is your arcuate line and your anterior superior iliac spine. So these lines, we always look to make sure there's no breaks in the pelvis. So looking here, we have your linea alba with your rectus abdominis and your iliacus, your psoas muscles. This is your sacrum, your sacroiliac joint, and your ilium. This is a CT, so we'll start here with your lateral mass of your sacrum. This is your iliac fossa with your sacrum, your sacral promontory, your sacroiliac joints on either side, and your ala of the ilium. CT also blown up, so this is your sacral promontory, your ilia, well, they call this the iliac fossa with your sacroiliac joints on either side. This is your lateral mass with your sacral foramen. This is a sagittal reformatted image of CT. So this is L5, this is S1, 2, 3, 4, 5. So there's 5 bodies within the sacrum, and then the coccyx has 3 to 5 bodies. Looking here at the iliac crest, we have the ala, anterior superior iliac spine, anterior inferior iliac spine, the body of the ilium, the acetabulum, the body of the pubis. We have superior ramus, the obturator foramen, the pelvis, the inferior ramus. We have the ischial ramus with the ischium and the ischial tuberosity. So the lesser sciatic notch, the ischial spine, the body of the ischium, and here's your greater sciatic notch with your posterior inferior iliac spine and your posterior superior iliac spine. The ala of your ilium with your sacrum and your coccyx down lower, you have your greater sciatic notch with your ischial spine. Your greater sciatic notch is here with your ischial tuberosity, your greater trochanter of your femur with your acetabulum, pubis symphysis, anterior inferior iliac spine, anterior superior iliac spine, and your iliac crest. So looking at a different angle here, we have your iliac crest with your ilium, arcuate surface right here, your posterior superior iliac spine with your posterior inferior iliac spine, your spine of your ischium, superior ramus, pubis, inferior ramus, ischial ramus, obturator foramen, ischium, body of the pubis, acetabulum, body of the ilium, anterior inferior iliac spine, and anterior superior iliac spine with your iliac fossa. Remember all this? All right, so all that should be reviewed. Now we're going to take a look at some images. This is a coronal MRI T1. So we have the, this is the pelvic brim. So we're going to look at the pelvic brim, and we're going to concentrate in on the pectineal line and the arcuate line. The pelvis never breaks in one spot. It's always in 2 places. So we always, if you see a crack in one side, there's got to be one somewhere else too. That's general standard rule of thumb. So here's your pubis symphysis and your ilium. So MRI coronal T1 also. So here's the crest, the ilium. Right here is your ischium coming down, your acetabulum, and the body of your ilium. This is a CT 3D We have some step off, so they didn't scan it in very high resolution. So this is your femur, your ischium, your acetabulum, the body of your ilium. Coming up is your iliac fossa to your crest. So bone of the pelvic bone, here's your pubic symphysis. This is the body of your ilium and your greater trochanter right there. Superior pubic ramus, your ischium, and then we have your ischial spine. If you labeled it either way, I don't care. And here's your femoral head. So here's your pubic symphysis, your inferior pubis ramus right there, and then your ischial tuberosity. So you got to look at how low we are. So you can see that we're below the greater trochanter. So looking at the pelvis, we have the false pelvis coming across here. This is your pelvic outlet and your pelvic inlet, and you can see your arcuate line with your pectineal line. And the pelvic outlet is controlled by the ischial spines that's in between. So looking up through the pelvis, we have your right inferior pubic ramus with your superior pubic ramus up top, and then you can see your ischial spines with your pelvic outlet right there. Looking here, we have the true pelvis, which is between the pelvic inlet and the pelvic outlet. So this is your true pelvis, this is your false pelvis up above, and it's separated by the pelvic brim, that line right there. Okay, what I want you to see on here is that there is a triangle. So this is female, so here, this is what we call the anal triangle. So right here, okay? So then there's the urogenital triangle right here. So there's two different triangles, and we look in that area for any kind of pathologies. So here, this is the male, so we have the anal triangle and the urogenital triangle up top. So looking here, this is a male. If you just saw this view, you wouldn't know, but here they give you the sagittal to let you know. So you have your pubic symphysis with your pubic bone, your prostate, and your urogenital triangle, and then your anal triangle. You can see the rectum within there. So there's the coccyx, your ischial tuberosity. Looking at the muscles, we're going to look here. You have your gluteus minimus muscle and you have your obturator internus muscle, which is covered up by your gluteus maximus. And here is your medius. So rectus abdominis, here's your iliopsoas. We have the gluteus minimus, medius, maximus. Maximus is way out and the minimus is always right along the pelvis. So here's your rectus abdominis, here's your gluteus minimus, medius, maximus. Maximus always looks like this heading out. Here, this muscle right here is your piriformis. So this is your iliopsoas on the inside, and your rectus abdominis, of course, up front. So here's a coronal Mri T1. We have obturator internus and externus. So obturator internus is on the inside, externus is heading to the outside of the body. That's how I remember it. So here's your gluteus minimus, and then the medius and the maximus. So you can see over here, this is the minimus, medius, and then your maximus on a coronal. Looking at the pelvis, just kind of give you a lay of the land. Here's your obturator internus. We have your piriformis muscle, so you can see how it connects, and I want you to see your psoas major. Your iliacus muscle kind of lies in the ala there. So your psoas muscles, your psoas majors, come down through the abdomen, and there's actually two of them, but I just want you to know it's the psoas muscle. Once it passes through the inguinal ligament, we're going to be at the iliopsoas muscle, and it attaches down onto right by the lesser trochanter. So coming around, these are the abductor muscles. I don't want you to know each individual one. When we're looking at an image, it's really hard to tell. So I just call them the abductor muscles. And then you have your sartorius muscle coming across here. This is so that you can cross your legs. And then this muscle right here is your pectineus. All right, so looking, we're going to start over here. So the femoral artery actually is more anterior than the vein, which is rare. Normally the artery is deeper within the body and for protection, but this is the one place that is more anterior, which is great when we're doing a femoral stick. So here, but doing a hip injection, you got to be careful. So here's your femoral artery, your femoral vein. This is your rectus abdominis muscle. Your spermatic cord is on either side down low into the abdomen. This is your sartorius muscle with your rectus femoris, your tensor fasciae latae, and your vastus lateralis. You have your iliopsoas muscle here with your quadratus femoris muscle. Your pectineus is right there. There's your rectum. This is a male, so that's the prostate. Your ischium is there. So looking at this image here, I wish my muscles looked like this. Clearly they don't. So here is your internal obliques. This is your rectus abdominis here. This is your sartorius muscle, and you can see your rectus femoris. This is a male, as you can see the package here, but the epididymis is here, and this is the left and the right testes. You have your corpus cavernosum, and you have your corpus sponginosum down below. So these two are the corpus cavernosum, and then your spongus cavernosum is down below. This right here is your spermatic cord, and then you can see lymph nodes within. So looking here, we have your we are going to label this as the iliacus with your psoas muscles. This person does not look like the last person. And here is your lymph nodes, and you can see here there's fat lining between the muscles, so it makes it a little easier. So this is your gluteus minimus, medius, maximus coming out. Rectus abdominis, these are lymph nodes here, and this is your psoas muscles and your iliacus and your iliac crest. So tensor fasciae latae with your rectus femoris, your sartorius muscle, your iliopsoas, your rectus abdominis, you have your bladder, your femoral head, your gluteus maximus coming out, and this is a female, so this is the vaginal canal right in here, and the obturator internus muscle, and we have the superior pubis ramus with your ischium, and your acetabulum with your gluteus medius muscle. So sartorius muscle, we have the rectus femoris, your tensor fasciae latae. I have to say it that way every time or else I won't be able to pronounce it. You have your gluteus medius muscle coming down, your obturator externus. This is your obturator internus on an axial. So this is your ischium, your gluteus maximus with your quadratus femoris and your iliopsoas right there. This picture, I just wanted you to see your coccygeneus muscle coming across here. That's the main thing. So rectus abdominis, bladder, rectum. Here's your coccygeneus. This person doesn't have a real big one. Here's your gluteus maximus. So coccygeneus is a better image of it right here, right next to the gluteus maximus. So if we start here, you have your pubis, pectineus muscle, you have your femoral vein with your femoral artery, your iliopsoas muscle. This is your IT band right there. So gluteus maximus, you have, I want you to know your rectum. There's some thickening there, I'm a little concerned, and the prostate. This is the Mri T1, so we can see the tissues really well. So this is the obturator internus muscle and your quadratus femoris and greater trochanter. Tensor fasciae latae, you have your rectus femoris muscle and your sartorius muscle. And you see the spermatic cord right there. So looking, we have your rectum, your gluteus maximus, obturator internus, and your obturator externus. That's all we're going to cover for that. We'll do one more PowerPoint covering the reproductive system, male and female.